Hi friends, I am Dr. B.V. Rao of Pushpa Clinic and founder of the websites qmedicaldoubts.blogspot.com and bhagavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medical. Today I am going to discuss about the shock. Shock is a combination of threat to the existence and the response of the body to this threat. Types of shock. The common factors in shock are loss of withdrawal of blood volume from the main vascular channels of the body, affecting the cardiac output, central blood pressure and the perfusion pressure of oxygen into the tissues, especially brain and the heart. Vasoconstriction, which serves to maintain the peripheral vascular resistance, the arterial pressure and therefore the oxygen perfusion of the vital structures. This is a protective mechanism which plays for time to time for the threat to cease, that is arrest of hemorrhage and the blood transfusion, so that fully recovery is possible, that is reversible shock. If the threat persists for repeated or replacement of the blood volume is not carried out, the anoxia to heart muscle and brain stem causes failure of these organs, thus impairing oxygen perfusion of tissues still further and causes a vicious circle, irreversible shock, ending in death. Contributory factors are the exposure, fatigue, and starvation and the extremes of life. Clinically, loss of blood volume, vasoconstriction is manifest as pallor, empty veins, cold skin, sweating and increased pulse. Restlessness and air hunger indicate hypoxia of brainstem. Types of shock. It may be several types: vasovagal shock, neurogenic shock or psychogenic shock. Occurs due to sudden fright, severe pain. The effect varies from slight pain to very serious effect. The hypoxia of the vital centers is brought about by cooling blood in the large vascular reservoirs like limb muscles and by dilatation of splanchnic arteries, which consequent low cardiac output and fall of arterial pressure. Still restored by peripheral vasoconstriction. Hemorrhagic shock due to accidents or any hemorrhages. Burn shock. The loss of blood volume is due to rapid plasma loss from damaged tissue and whole blood destruction. Dehydration, diarrhea and vomiting. Severe loss of extracellular fluid is usually associated with infection and loss of protein. As a result, inflammation of the intestinal mucous membrane. Pleural peritoneal mediastinal retroperitoneal shock. Due to sudden leakage of blood, elementary secretions into these compartments will cause sudden collapse. The examples may be the penetrating wound of the chest and hemothorax, a leaking esophageal or intestinal anastomosis, acute pancreatitis, biliary peritonitis. Bacillus coli shock, intestinal shock or gram-negative shock. Multiplication of Bacillus coli occurs in segments of strangulated intestine in conditions like strangulated hernia, mesenteric thrombosis and in peritonitis. The endotoxins from the bacillus causes splanchnic arteriolar dilatation and blood volume discrepancy. Release or removal of the strangulated segment or the drainage of pus is the important particular factor in obtaining the recovery of the patient. Bacteremic shock from other infections. Gas gangrene is a typical example, causing a decreased blood volume and also anemia from hemolysis. Anaphylactic shock or histamine shock. It may follow the injection of serum in spite of precautions to patients who have serum before or who have a history of allergy. There is a wide dilatation of splanchnic vessels with consequent fall of venous return and cardiac output, necessitating immediate injection of adrenaline 0.5 to 1 ml, 1 in 10,000, 1 in 1000 solution, which may need to be repeated in doses of 0.5 ml every 30 minutes till the systolic pressure remains below 100 mm of Hg. Diagnostic difficulties of shock. Difficulties occur with intra-abdominal issues as peritonitis and bacillus coli shock may be confused with infarction and pulmonary embolism. ECG and X-ray of the chest do not determine the diagnosis. Exploratory operations confirm the diagnosis and recovery results. Treatment of shock. The principles of treatment is the removal of the cause and the replacement of lost fluid and blood volume. In case of hemorrhage, arrest of hemorrhage and blood transfusion. In burns, the loss of plasma is replaced by the plasma and dextron. Bacillus coli and bacteremic shock require removal of the cause and transfusion of blood or substitutes as indicated. Position and limb compression. Venous return is improved and pooling of blood in the large muscles of leg is reduced by raising the foot of the bed and bandaging the limb to compress the peripheral blood vessels. The vasodilatation will nullify the compensatory reflex vasoconstriction. Relief of pain. It is achieved by giving morphine 10 to 15 milligrams IM or IV should not be given subcutaneously as it is not easily absorbed. If repeated doses are administered, excessive amount is liable to be absorbed when the circulation improves. It is contraindicated in head injuries. Sedation. Used in case of frightened patients, phenobarbital 60 to 100 milligrams IV or paraldehyde 5 to 10 ml IM. Vasoconstrictor drugs. These should be given early. If given late, their action, if any, will only serve to accelerate the damage caused to kidney and liver by intense prolonged vasoconstriction. The drugs used intravenously: methylamphetamine, methadone 15 milligrams and noradrenaline 4 milligrams per liter. If intravenous fluid, the rate of flow is adjusted according to the response obtained. Hydrocortisone hemisuccinate in dose of 100 milligrams may be added to the intravenous fluid. It raises the blood pressure possibly by sensitizing the peripheral vascular nerve endings to naturally circulating noradrenaline. Care is taken to wean the patient from vasoconstrictor drugs as soon as possible to avoid drug dependence. That's all about the shock, and in the next video I will discuss about some other disease. Thank you.